Thanks, Toli, and the viewers at home. This study came when we kept on asking the Department of Health KwaZulu-Natal on what could have been the causes of these infections, because when the numbers started to increase on infections of health workers, we asked the employer on what could be the reasons behind. They said they are providing the proper PPE, but it did not help. Then we said maybe this type of masks are problematic, because when you see some of the boxes carrying these masks that were shared to our members to use, some were written not for medical use, some were written dust mask. That is where we became aware that something is not right with this mask. So the study was conducted by the University of Cape Town, which came to conclude that our suspicion was correct, that some of these masks are not protecting our members, especially this KN95, because we kept on saying we don't want to be caught in between blaming the department or the state, but we are saying something must be done to investigate this type of mask. What could be the cause of it? Because people are continuously getting infections while wearing this mask. This is where the matter came about, Tuli.
Are you aware of the manufacturer of these KN95 masks?
Unfortunately, the companies that the research focused on, there were about 17 of them, if I'm not mistaken. And the names of these mask companies were not disclosed by the research, but we are looking into getting the names of these people so that we name and shame those who took chances in procuring this mask, because it is not all companies were supplying, but the batch that was identified to be problematic, the researchers have all information about those companies, but they decided for ethic purposes not to pronounce on the public which company does this, but those companies are known by the researchers, and we are working close with the university to check what can be done for us to get the bottom of this, to say, who are these companies that decided to use substandard of mask?
Yeah, over 8,000 health workers in KZN have tested positive for COVID-19, Mr. Shabangu. Talk to us about the fatalities cumulatively. In total, how many workers would you say have died of COVID-19 in KZN?
Actually, it is very disturbing to learn that such number has been reported, because in our view, that is not a true reflection of what we are hearing from the public, because the numbers are worse than what are reported. Actually, what needs to be taken into consideration is that we are surprised that now the department or the state is surprised to say why so many people are dying, because it is the very same state who come out with good guidelines or regulations to say health workers managed, but the same state is ignoring or undermining those regulations. I will quote one regulation which was issued by the National Department of Labor to say how should the vulnerable employees be managed. And until today, only, there is a committee that was formed, which is IRA, which is Iraq's committee. That committee is Institutional Risk Assessment Committee, which is responsible to identify and come up with solutions on how should the vulnerable employees be managed during COVID. But those committees are not sitting, hence to find the rate of infections and death are occurring on members that we are of the serious view that these are forming the category of the vulnerable employees that the employer until today has failed to come out with a clear plan of how to accommodate our vulnerable members. Because these members have come forward to submit to the HRs that they are having these comorbidities, and some because of age, but the employer have done zero in trying to help these workers, even to give them the proper PPE, because there was a recommendation that for nurses, it is proper that when you cannot work from home, what should happen is that the same department must come to a place where all workers with comorbidities are wearing the PPE as if they are nursing a COVID patient. But that is not happening. That is why we are saying we are surprised that now they are acting surprised why the numbers are going up, because it is their own doing that they are failing to follow the proper rules of managing the comorbidities with our members.
It sounds, Mr. Shabangu, it sounds like you do not agree with the official statistics that are being given as to the number of nurses that are getting infected or those that are dying. So I'm going to ask you again, to your knowledge, how many health workers in KZN have sadly died of this coronavirus?
To our knowledge, there are more than 200 nurses who have died in this information that has been shared. We don't know how they got it, but when we discuss these issues from the regions across the 11 districts in our province, the numbers are not what was presented. The final statistics we got were just above 200 when we collected the information from our shop steward at the grassroots level.
Right. And what about the danger pay, the COVID-19 danger pay that you have been asking for? Where is the process there? Has there been any update?
Unfortunately, Kholi, you'll understand that this administration led by President Cyril Ramaphosa has no appetite in assisting any healthcare worker. It looks like their intention is to frustrate and sabotage them. What is happening is that anything that is brought on the table to discuss on behalf of the healthcare workers who are purported to be the frontliners is being crushed out. There is no will to come even close in saying what incentive can be given to these workers. The matter is sitting in a PSCBC for discussion, but the employer has made it clear that they have no appetite in giving workers the incentive, let alone giving them what is due to them, which was their salary increase for 2020. So it is clear to everyone, Toli, that this administration has no interest to the public servants. Their intention is to make sure that public servants are stressed, public servants are isolated, and they feel that they are useless. Because what is killing our members, West Toli, is that our members are working under a serious conditions that is stressful. There is no one coming forward to support them psychologically. There is no plan in place from this department to say, how should workers be supported when one loses a colleague who was working with you, when the colleagues that are working with you are infected? There is no support whatsoever. Even if you find that in a ward, you were 5 and 3 of you have tested positive, there is not even a plan to replace those people while they are sitting on quarantine or isolation. All what is expected from these nurses is to continue working as if it's normal. Nurses are very demotivated and stressed by the practice that is endorsed to them by this current administration of Cyril Ramaphosa.
Yeah, I think your words are very clear, Mr. Shabangu, that the president, although publicly he comes across as someone who is very sympathetic of the situation that healthcare workers are working under. You saw him, I think it was just before New Year's, addressing workers in Cape Town. I think it was in Khayelitsha. And he sounded like a person who really understands the difficult conditions that health workers are working under. But you're not very convinced by the work being done behind the scenes to support these workers. That leads me then to ask you about the vaccine. We heard the minister saying that the workers are going to be prioritized because they are frontline workers, healthcare workers, that is. Do you believe and do you support that indeed government is working fast enough to secure these vaccines, because it's come under a lot of criticism lately that they've basically been slow off the mark?
To say they are slow is an understatement, Toli, because COVID-19 came in March in this country, but all countries have been working towards getting the vaccines agreements with other countries, while South Africa has just kept quiet and said they're behind the doors doing nothing. And as late as now, they are saying they are still discussing, while other countries have secured the deals as early as September. Countries who prioritize their healthcare workers have done so. They've started vaccination already, while we are being told that we are still discussing. It is very disturbing to learn that even now there's no date set to say when will healthcare workers get this vaccination. It shows that this government don't care about the healthcare workers. All what they are doing is these rhetoric statements. They keep on saying that you are our heroes. What heroes? You don't treat your heroes like how this government is treating these employees. So we do not get this thing as if saying that we are discussing it. What have they been doing all along? Because the question is, other countries started discussion still when the virus was at its peak. And South Africans, we expected that the minister and his team will be amongst those who were discussing. But now we are told that if we are lucky, the vaccine will come in February. What will be happening to workers between today and February who are dying like ants?
Well, Mandla Shabangu, all these questions, I think they better be put to the man who's leading the country at the moment, Cyril Ramaphosa. Thank you very much for your time.